Whether you work in the hospital
or a community clinic,
in a northern community,
or a rural hospital,
every single physician has been impacted by COVID-19.
Every day, physicians don and doff PPE to protect ourselves, our patients, and our families.
But shouldn't the very concept of being personally protected go just beyond masks and gloves?
What about psychological PPE to protect doctors against the stress, burnout, and distress the pandemic is causing?
Even before COVID-19 was on anyone's radar, we knew that physicians have higher rates of mental health challenges than the general population.
A survey of Canadian physicians found that nearly 1/3 reported signs of burnout or depression.
Emerging studies are finding these rates are even higher during the pandemic as physicians face uncertainty, pressures, and risks as never before.
But now, in the middle of the biggest public health emergency in over a century, we have to stop staying silent if we are struggling.
And we need to be there for those colleagues who need our help and support more than ever.
So what should we do? Start by grabbing your cell phone
and add the phone number for our 24/7 physician and family support line.
It's 1-844-436-2762. Go ahead, we'll wait.
You never know when you might need it, or when you want to have it handy for a family member or a colleague in need.
Remember, this pandemic is a marathon, not a sprint.
Every physician is different, and what helps you build resilience and helps you cope is truly personal.
What is universal, however, is that every physician needs psychological PPE.
No physician is immune to the risk of burnout, depression, anxiety, or distress during this crisis.
So, what else works?
At home, I'm appreciating and enjoying the slower pace of life. I am seeing opportunities to do things I would never have had time for before.
I set time aside with the family. We all agreed that no matter what time I came home from work, we'd sit around the table to eat.
I make a point of checking in with someone daily, a family member, a friend, a colleague, a mentor, or a mentee.
For exercise, we work out at home and we walk our dog Yoho.
It's important to realize that we can't solve every problem. We need to be kind to ourselves and to others. I try to take time to reflect, and I use mindfulness and yoga to manage stress.
As much as possible, I try not to be consumed by the medicine bubble. I consciously limit my time on social media and watching the news.
Reach out if you're struggling. It's the people who get us through residency in medicine. You realize that we're part of such a well-supported community and that our interconnectedness makes all the difference.
COVID-19 has helped me to find balance in my life. It helped me to identify what's really important to me in life. My family, date nights with my husband, reading books, and finding time to exercise and take some time for myself in amongst the chaos of daily life.
Take the time to figure out what works for you.
Self-care is not selfish.
And know that your colleagues and Doctors Manitoba are there for you every step of the way.